Welcome to this explainer. Look, when your child gets diagnosed with a heart condition, it literally feels like you've been dropped into a completely foreign world without a map. Well, our goal today is to give you that map. By breaking down the intense medical jargon into clear, everyday concepts, we want to help you confidently partner with your medical team and advocate for your child's health.
All right, let's map out our journey together today. We're going to cover 1. Understanding pediatric heart failure. 2. Spotting causes and symptoms. 3. Diagnosing the condition. 4. Treatments and medical interventions. And finally, 5. Living with heart failure. Okay, let's kick things off with Section 1, Understanding Pediatric Heart Failure. We need to demystify exactly what we're dealing with when we hear this incredibly frightening medical phrase.
So, what exactly does heart failure mean for a child? You know, it's totally normal to feel completely overwhelmed when you hear those words from a doctor. I mean, failure sounds so final, right? It sounds like a sudden stop. But what's actually happening inside your child's body?
Here's the absolute crucial point to remember. It does not mean the heart has suddenly stopped beating. Instead, I want you to think of the heart mechanically. It's a muscle designed to act as a pump, sending oxygen-rich blood all over the body. In heart failure, that pump simply isn't working at full capacity. Because it's not pumping efficiently, parts of the body just aren't getting the oxygen they need. And almost exactly like a plumbing system that isn't draining fast enough, blood and fluid can start to back up, which leads to congestion in the lungs or other areas.
Moving right along to Section 2, Spotting Causes and Symptoms. Let's look at what actually causes this vital engine to struggle in the first place and the warning signs you need to watch for. The heart can struggle for a variety of reasons. It could be from cardiomyopathy, which is an inherited, enlarged heart muscle. Or it could even be a side effect of certain cancer medicines. Irregular heartbeats, infections, and severe anemia are also potential triggers. But, and this is important, the most common culprit in kids by far is congenital heart defects. That means structural issues that are present right at birth.
Now, symptom-wise, things look pretty different depending on the child's age. An infant obviously can't just look at you and say their chest hurts. You have to be a bit of a detective. If an infant is sweating profusely just from the effort of feeding or playing, or if they're vomiting and failing to gain weight, their heart might be working way too hard. Older children, on the flip side, can communicate more directly. They might experience unexplained weight loss, episodes of passing out, or actual chest pain.
But regardless of age, there are universal signs you've got to watch out for. When that pump isn't working, fluid backs up. This causes generalized swelling, called edema, which you can often spot in the feet, belly, or neck veins. You might also notice rapid breathing or extreme, totally unexplainable tiredness. The severity of these symptoms is really a direct reflection of how much that pumping ability has dropped.
Okay, Section 3, Diagnosing the condition. You've spotted the signs, you're at the doctor. What happens next? The diagnostic phase is all about gathering precise data.
To quote Stanford Medicine Children's Health, if the provider thinks your child has heart failure, your child may need to see a pediatric cardiologist. Your primary care doctor will do a physical exam first, but they're going to refer you to a specialist who is equipped with the exact tools needed to investigate these complex internal mechanics.
This diagnostic journey builds incredibly logically. 1. Blood and urine tests. 2. A chest X-ray to check for any lung or heart changes. 3. Electrocardiography, or an ECG, to check the electrical rhythm. 4. Echocardiography, which is an ultrasound of the heart chambers so they can see the pump in action. And 5. Cardiac catheterization, which involves threading a tiny tube directly into the heart to actually measure the pressure and oxygen inside.
All right, Section 4, Treatments and Medical Interventions. We have a clear diagnosis in hand. Now let's explore the incredibly robust toolkit we have available to help support and fix your child's heart.
When we look at the pharmacy of available medicines, it really helps to understand the mechanical job each one performs. Digoxin helps the heart beat stronger and more regularly. Diuretics, basically water pills, physically remove that extra backed-up fluid. ACE inhibitors and ARBs act on the plumbing itself, opening up the blood vessels to lower blood pressure. And beta blockers lower the heart rate, essentially taking a huge workload off the engine.
Beyond medicines, we have advanced interventions. If a congenital defect is causing the failure, surgically correcting it can be an absolute game changer. Other interventions range from utilizing pacemakers and cardiac resynchronization therapy to regulate the heartbeat to mechanical support devices. And for the most critical situations, a heart transplant may be necessary. Alongside all of this, supervised exercise rehab and specialized nutritional planning play absolutely massive roles in recovery.
This brings us to Section 5, Living with Heart Failure. Let's bring this home to what your day-to-day reality as a caregiver will actually look like. Because managing pediatric heart failure really is a marathon, not a sprint.
Daily management at home is everything. Your routine is going to revolve around administering daily medicines with absolute consistency, utilizing specific nutritional supplements to make sure your child gets the energy they need to grow, following a tailored activity and exercise plan guided by your cardiologist, and attending frequent checkups at a specialized pediatric heart center.
As a caregiver, you are the first line of defense, so you need to know exactly when to call the doctor. Keep an eye out for noticeable swelling, extreme tiredness, or a sudden refusal to eat, sudden unexplained weight gain, which is usually fluid retention, pale skin coloring, or palpitations. If you see these, get on the phone with your clinic immediately.
And I want to be super clear about this. There are certain critical triggers that require you to bypass the clinic entirely.
These are your emergency triggers, where you dial 911 right away. If your child experiences chest pain, if they have sudden trouble breathing, or if your child faints or becomes completely unresponsive, do not wait. Treat this as a critical emergency.
To help you manage all of this with confidence, here is a caregiver's checklist for your doctor visits. 1. Write down questions before arriving. Seriously, don't rely on memory here. 2. Record names of any new diagnosis or medicines. 3. Ask about specific side effects and alternatives. 4. Understand exactly why a test is ordered. And 5. Always confirm follow-up dates and after-hours contact info so you are never left guessing in the middle of the night.
Understanding is the very first step to empowerment. Equipped with this knowledge, how will you partner with your care team to protect your child's most vital engine? You see, you're no longer just a bystander. You are an informed advocate now. So step into that next appointment with confidence. Keep learning, keep asking those hard questions, and remember, you are an essential part of your child's journey. Thanks so much for joining me for this explainer.